In 2010, the Mesa County Advanced Practice Center at the Mesa County Health Department worked with Family Health West Hospital to establish plans and procedures for integrating volunteers into the hospital during emergencies. Through this process, the Mesa County Advanced Practice Center created the online toolkit Blueprint for the use of volunteers in hospitals and rural medical centers. This toolkit was designed to help local health departments, hospitals, and volunteer medical reserve corps units across the country to work together to plan for the use of volunteers.
Mesa County began the process of integrating volunteers into hospitals over 7 years ago as a result of a needs assessment that we did through Mesa County Public Health in cooperation with our ESF-8 partners, our Emergency Support Function 8 partners. One of the gaps that was identified was the real lack of integration with the hospitals to the volunteer surge needs of the county. And so through that needs assessment process and through identifying that as a gap, we also began to start to identify those elements that needed to be addressed. For example, creating a volunteer database, identifying the scope of practice of volunteers in hospitals, coming up with some volunteer policies and procedures. The volunteer coordination role is a key role for doing that, as well as then training the volunteers and training the hospital employees and staff to learn how to accept volunteers into the hospital. So the whole process began a long time ago with the assessment process. The elements to address those gaps slowly took place and culminated in the development of the APC Blueprint for the use of volunteers in hospitals and rural medical centers toolkit, which was developed out of that APC project.
The role of emergency management is to create the emergency planning framework that all the emergency support functions integrate into. So ESF-8 is one of 15 support functions that fall under the emergency operations plan for the county, which is the umbrella under which they all come together and work. Well, the ESF-8 structure provides a great opportunity for the Medical Reserve Corps to integrate into the emergency response framework because of the established relationships and their ability to work together on common medical-related issues. So what binds the ESF-8 partners together are common problems that have common solutions. So it's an obvious point of collaboration for ESF-8 partners to work together because they often have common grant deliverables, common certification requirements, and by working together, they practice together, which means in a time of an emergency, they will be able to work better together.
Hospitals in particular have to be involved in the community and the ESF-8 group and partner and quit trying to be siloed. Many hospitals do the same exercises, have the same requirements, and use the same transportation agencies, the same EMS providers. And when they work together, like in the ESF-8 group, then planning gets much easier, workshops get much easier, everybody gets on the same page, and the whole community benefits by people talking to each other.
When the Medical Reserve Corps first formed in Mesa County, they approached some of our healthcare partners just cold turkey and said, we'd like to help, we want to volunteer. And the healthcare partners were just, we have no idea what to do with you. And because of that, you know, I really felt like there's a role for volunteers because we know we're going to need surge staffing. Well, I've always felt like the Medical Reserve Corps would be accepted more readily by our healthcare partners if they could see how they were successfully integrated. And Mesa County Health Department has made an effort over the last several years to use them at flu clinics and in exercises in roles that reflect their training as medical people so that we could be a pilot program, a model for the community, so they could see volunteer nurses giving shots, so they could see those volunteers that help us, that are non-medical, that help us with logistics and parking and greeting and filling out forms, that so the public can see and our healthcare partners can see a viable role for volunteers in their hospital. Someone has to be the champion to show how volunteers can be used safely and effectively in a response. And one of the areas that we're still working on is how to utilize volunteers during an emergency. And after Family Health West allowed us to use their hospital as a pilot program, the other hospitals in Mesa County now are taking the initial steps to pull in volunteers. We have developed job action sheets and org charts, and we've gone through the liability discussions with the hospitals. We've developed a volunteer handbook that is a template for hospitals to use. It's kind of like that movie Field of Dreams. If you build it, then when you need the volunteers, they can come. But if you don't have the infrastructure in place, then you can't even begin to think about how to use volunteers. You know, I think it's important to note that the use of volunteers, medical volunteers during an emergency in a hospital, is useful not only for the larger hospitals that have the major population areas, but also rural hospitals that are that really can't handle much surge at all.
We have a finite number of staff. If something happens that a lot of people get sick and have family members sick, we lose our staff. If we lose our staff, our patients don't get cared for. If we don't have the volunteers to supplement that, you have to plan for things that hopefully won't happen, but you have to look at the worst case scenario. So planning to use the volunteers makes it a much more effective process. One of the biggest things about using volunteers in the hospital is getting the staff to realize that they need the volunteers and how the volunteers can assist them. And getting the staff buy-in to use volunteers is probably the biggest issue of all. And to do that, you have to sit down with them and put it in black and white and say this was what would happen. Healthcare providers, particularly nurses, are pretty sure that they can do everything and they don't need any help and that they can just power through and get it done. And when you sit down with them and put it in black and white, and who's gone, who's not here, what you need, they suddenly have this epiphany that I'm going to need some help. And then they're far more willing to have volunteers at their side. When it comes to everyday business, volunteers are usually used in a hospital to deliver magazines, take tea, deliver mail, show visitors where to go. When it becomes an emergency situation and these volunteers have the education and the experience to benefit the patient care side of things, the hospital is often hesitant to think outside the pink lady, quote unquote, box and to use them as an adjunct to the staff. A lot of it is fear of HIPAA violations. A lot of it is fear of state board violations of the Nurse Practice Act or the Physician Board. A lot of it is fear that the person who's there doesn't know what they're doing. It really is helpful if the hospital works with the MRC coordinator in their area and gets the volunteers pre-credentialed and has a little checklist that says, you know what, I was a nurse for 35 years and I worked in the pediatric ICU. I know how to take care of children. I'm not taking your job, but I can help you and I can support you.
There are limited resources, and if your staff doesn't feel that you're committed to it and that you're going to allocate the resources, which usually have a dollar sign on them somewhere, even if it's soft cost as we call it, we don't pay them extra, but they're not doing their job, they're doing the emergency preparedness piece. So there's a cost. They need to know that that's important and that you're going to support it, that you want them to do it. And as far as volunteers are concerned, people volunteer because they have a heart. They want to be involved in what's happening in their community or in their hospital, and they want to make a difference. If they don't feel that administration is supportive, they won't last. They need to feel valued. They need to feel special, and that happens by bringing them in and showing them how important it is, and also just continue to communicate, involve them. Anytime, I think administratively, anytime you have an event, your volunteers should be invited. They're a part of your team. They may not be being paid, which should make them even more valuable if you're in administration, right? It's more cost effective. They need to feel like they're a part of the team. Every volunteer, when they ask, what do you do? They say, well, I volunteer at the hospital. What does that mean? Well, I'm on their emergency preparedness team, or I do this, or I'm back up for admissions if there were an emergency. That ought to just be natural for them. They ought to feel that committed, that involved, and that comes from administration. If they don't see that administrative support, then they don't feel valued. And if they don't feel valued, they go away, and then when you need them, they're not there.
You can't write the recipe during the emergency. You've got to do it beforehand and walk it through and exercise it so everybody on the staff knows where the volunteer is going to fit in and what their role will be, what their assignment will be.
Well, before the hospital can call the volunteers, there has to be an idea of how to use them. And there has to be a plan to use them, and that needs to be in the hospital's emergency operations plan. The main components: what are you going to do with the volunteers? How are you going to make sure that they're the people you want? Where are you going to place them? And how can you make sure that they are credentialed appropriately and used appropriately so that the volunteers are satisfied and the hospital is helped?
Well, it's important for the hospital and the volunteer group to work together to decide on the process they're going to use for doing background checks and credential verification of volunteers before they can be used in a hospital. Now, a hospital may decide to use its own system that it uses for credentialing their employees. As with Family Health West Hospital in Fruita, Colorado, before their full-scale exercises, they used Allison, or the Automated Licensure Information System Online, which is associated with DORA, the Department of Regulatory Agencies. You can also use the ESAR VIP, or Emergency System for Advanced Registration of Volunteer Health Professionals, if the hospital is familiar with the system and is comfortable with its level of functionality. Either way, the hospital is going to go with the most thorough process that's also timely and cost-effective.
So when it comes to the just-in-time training that the volunteers need when they're coming to help the hospital, we used the volunteers and the hospital staff to determine what should be done. And then at the hospital, we sat down amongst the nursing staff and thought, what would we want a volunteer to do? And made a checklist. And included in that checklist is basic life safety for the hospital. So no matter where the volunteer is, they need to know where the fire alarms are. How do they get out of the building? Where's the safe zone? What do the codes that are called overhead mean? So we go over that with them and then give them a basic overview of what's in the department. How do you operate the vital sign machine? Where does that piece of paper go? Who's your point of contact? It's a checklist that we go down with them, each volunteer on their own, with a preceptor type person, and just review what's expected of them, how they can do it, and who they should ask questions of. Having that just-in-time training checklist developed by the hospital staff really makes it personalized to the facility and to the department, because they're all slightly different throughout the hospital. But that way the volunteer knows exactly what they're going to do and who they're going to talk to.
When Mesa County Health Department initially started the planning process with Family Health West Hospital, we held some workshops for the hospital staff and the volunteers to provide feedback on the just-in-time training sheets and the job action sheets that we created as templates. That process allowed the hospital and the volunteers to develop a well-defined list of volunteer roles in a hospital and the appropriate scope of work for the volunteers who would be used in a hospital.
The way you get a volunteer to play, at least in my experience, is you give them responsibility and you keep them in the loop. If I'm a part of the flow of information, I feel like I'm a part of the team.
The main way that partners ensure that plans are being improved is to go through that training and exercise cycle from the very beginning, from orientation of that particular gap that they're planning on exercising or training in, all the way through culminating in a full-scale exercise. So the hospital utilizes the training and exercise cycle to use that building block approach to move from the orientation exercise to the tabletop, culminating in the full scale and the functional exercises. The discussion-based exercises first, the operations-based exercises second. So once they make it through that cycle, then they begin the cycle over again with the gaps that they've identified. Hospitals in Mesa County, and as well throughout the state, are part of a hospital preparedness program, and they get funding through the CDC to be members in that type of a program. And one of the key requirements of that program is training and exercising. The needs for the hospital to train and exercise predated the hospital preparedness program, and most hospitals have a fairly robust training and exercise program that includes surge medical exercises, exercises that stress the hospital's emergency department functions, maybe their internal functions. It just varies depending on what their identified gaps are in that training and exercise cycle that they are in for that year. But most hospitals generally perform one of two exercises: a 96-hour exercise where they are supposed to go without support for 96 hours in terms of staff support or supply support from the outside. The other one is a patient surge exercise where they stress their patient surge capabilities, the ability to take an influx of infectious patients or an influx of injured patients from a mass casualty incident, for example. So hospitals have to do that type of training and exercising. The use of volunteers in hospitals is really a key aspect of their ability to do those things, either drawing within their own resources or drawing from resources in the community.
Make them feel valued because they are. Having that resource available makes a huge difference.
For more information, visit the Blueprint for the Use of Volunteers in Hospitals and Rural Medical Centers online toolkit at health.mesacounty.us/MESA-APC. We would like to thank our partners in the development of the Blueprint Toolkit: Advanced Practice Centers, Mesa County Health Department, Family Health West, and the